welcome Aubrey de Grey, the Chief Science Officer of SENS Research Foundation. We've been working on regenerative medicine and strategies, the overall strategies for reducing the deleterious effects of aging for quite some time now. So, yes, thanks so much for joining us. And yeah, there's been quite a bit of funding progress at SENS. I thought it would be good to start there. I think the co-founder of Ethereum donated millions to the organization recently, which is really great.
Yeah, we're very happy about it. I mean, in fact, over the past few months, it's been quite well. The situation with funding has been fairly difficult for us for the past couple of years because the money that I donated back in 2011 ran out in 2016 on schedule. We made a decision right at the beginning that we would spend it over a period of 5 years. And it was very well spent, but of course it did mean that we had a big shortfall to find from other places. And it was pretty tight during last year. But as you say, towards the end of last year, we had a bunch of very good news. In fact, we had 4 donors come in at a 7-digit level, totaling about $6.5 million, all cryptocurrencies, 3 Bitcoin donors and one, as you mentioned, about 2.4 million from Vitalik Buterin. The 3 Bitcoin donors are all anonymous, but that's okay, their money isn't. So we're very, very happy about that, and it's certainly going to make our lives a lot easier for the next little while. Of course, we're not going to spend it all at once because we don't know whether the same thing is likely to happen going forward, but it certainly means that we're on a much securer footing than we were.
Right, so that's great that the work can continue. So what kind of research will that money help progress at the moment?
Well, first of all, it means that we will be able to expand some of the projects that we're already doing. One in particular that we're doing at the Buck Institute with Judy Campisi, looking at stimulating the immune system to get rid of senescent cells. We are currently planning an expansion of that project, which will in fact happen partly in Judy's lab and partly in our own facility down in Mountain View. So that's going to be nice. We're already looking at a few new projects to start. We've had quite a shopping list for quite a while, and it's definitely time that we were able to start funding those projects. And of course, it also makes sense to do that because we have had plenty of success over the past couple of years in graduating some of our projects. In other words, getting them to the point where they could be spun out into private startup companies that can acquire investment. And that, of course, frees up more resources, both in terms of money and in terms of space, for us to do more work.
Fantastic. Okay, so AgeX Therapeutics is one of those. Do you want to just
actually, no.
Oh, no.
No, so AgeX Therapeutics is a subsidiary of BioTime, which is the company currently run by Mike West, who, of course, in earlier life founded both Geron and Advanced Cell Technology. So AgeX is not a spin-out from SENS Research Foundation. It's a subsidiary of BioTime. And I think the reason you probably mentioned it was because about 6 months ago, Mike persuaded me to join AgeX in a part-time position, about 30% effort. So my title there is Vice President of New Technology Discovery. And what I'm doing there basically is very nicely complementary to the work that we do at SENS. As most of the audience probably know, SENS is kind of a 7-point plan for defeating aging, which divides the various types of damage that the body accumulates into these 7 major categories. And 3 of those categories are to do with either having too few cells of the sort we need or too many cells of the sort that we don't want, whereas the other 4 categories are molecular. They are to do with changes that happen either inside the cell or in the extracellular space. Now, the progress that we have made at SENS Research Foundation over the years has been most impressive actually on the molecular aspects. All four of them have seen quite a lot of progress as a result of our work. And the cellular side, we've worked on it, but I guess our efforts there have been less impressive in terms of their actual progress. Whereas Mike West's work throughout the 20 years that he's been in this field or more now, has been very much focused on the cellular side, on stem cells and on eliminating cancer and eliminating senescent cells. So it's very appropriate that Mike and I should finally find a way to work together. And of course, I've looked up to Mike very much all this time that we've known each other. So, I'm really delighted at this new association that I have.
Well done. Yes, it's great to have good alliances in these fields. Now, it's interesting. I heard in another interview of yours that you've stepped back from pursuing certain lines of research because the industry has taken up this line of research, and it's showing that like what you're doing is providing existence proofs or helping providing existence proofs of certain lines of research that other companies or outfits or organizations can continue the research where they have the funding to do so. So that's, and you've always said like your goal is to put yourself out of work.
Well, kind of. So that's a bit of an oversimplification. Certainly in principle, the ultimate goal of SENS Research Foundation is indeed to put ourselves out of a job, to be able to get all of the projects that really matter to a point where they're being pursued capably and aggressively in the private sector or by other people. But we're in no danger of getting to that point anytime soon. We have succeeded in spinning out quite a few projects, so far a total of 5 into startup companies, but we've certainly got plenty more to go. And our business model will remain very much that the foundation in and of itself is not really well placed to do the whole job. And obviously there are a lot of people out there who just don't like giving money away anyway. They prefer to invest rather than to donate. So it makes sense that we should put ourselves in the position of being effectively the spearhead of and the engine room of the industry, getting projects to a sufficient level of proof of concept that they become attractive to at least the more visionary type of investor that we tend to talk to. But yes, certainly I can't see myself being able to step back from any of this for a little while yet. And the foundation profit certainly also is likely to continue to play an absolutely indispensable role for some time. In fact, I just should say one more thing about that, which is that often when we speak to people who are predominantly of an investment mindset as opposed to philanthropic, we try to persuade them that actually they should donate to the foundation as well as investing in our spin-outs, simply because if they donate, then they get access to information. They get to talk to us a lot more. They get to understand what's coming, and they get into a position to be the lead investor, the first investor, the seed investor in some new project that may be spinning out in the future. And I'm pleased to say that argument has seemed to be persuasive. So most of the people that are investing in our spin-out companies are also giving us substantial donation money as well. And I'm hoping that trend will continue.
Yes, and it is a philanthropic endeavor to try and reduce suffering in the world by, having better medicine and access to these medicines, having it like researched and everything means that we'll be getting to a time a lot faster where it's cheaper and more affordable for everybody to have access to this medicine, to these sorts of therapeutics that ultimately stave off the damages accumulated as a process of aging at the moment. So it's not just about making money, and it's great if you can as well, but it is really a philanthropic endeavor. I always like to stress that.
Sure.
Yeah. So it's interesting. I saw a big talk by Jennifer Doudna, who's the co-founder of CRISPR, and some other people talking about the implications of such a technology. I got this sense that they were very careful about how they presented and curated the information for public consumption, but also the consumption for other scientists. But it seems to be, on one hand, we're getting to a stage where science is having more faith in the long-term view of regenerative medicine. And I mean, it's not just like a buzzword, it's actually an industry now, which is great. But also what I'm worried about is some of the dialogue and some of the uses of language to express these ideas that might frighten away investors or scientists who are working at the coalface or funding the coalface industry that will ultimately make the material progress in these fields. So, immortality is a word which is bandied out quite a bit amongst all the transhumanist community and amongst a lot of titles sort of talking about this research in media. So what are your thoughts on the using of language?
Yeah, I mean, certainly we do have to be careful. I mean, of course, there's a balance there. One can be too careful. I think that gerontologists have, as a community, rather shot themselves in the foot over the past maybe 20 or 30 years by shying away too aggressively from anything translational, from even talking about doing something about aging. Certainly in the past 5 or 10 years, that problem has been alleviated. It's to talk about doing something about aging. But even now, there is still a great deal of fear about talking too radically. People in gerontologists, mainstream gerontologists will now be perfectly happy to talk about damage repair and medicine for aging, and addressing aging as a divide and conquer damage repair problem, which of course is exactly what I've been saying for the past 15 years. But you won't get any mainstream gerontologist going anywhere near longevity escape velocity. They will all run away very fast when one talks about radical longevity. And yes, the media is a good part of the problem here, because the media, of course, are in the business of selling papers. They have to, and so they will tend to use words like immortality, and they will tend to downplay the fact that the longevity benefits of this work are simply a side effect of the health benefits, which is, of course, the absolute central message that we have to get across in order to get people to understand that this is worth doing and that it's a really important mission.
Mm-hmm. So, I mean, in your experience, what works with different crowds? I mean, when you're talking to a bunch of scientists, what words, what language won't you use, or you're less inclined to use than when you're talking to a bunch of transhumanists or futurists?
Well, actually, it's neither of those two communities that are problematic. When I'm talking to scientists myself, I don't need to talk about the social implications or anything. I'll just talk about the science, and there, it's just a perfectly straightforward technical conversation. It doesn't get into any kind of difficulties. When I'm talking to transhumanists, life extensionists, techno-visionaries, shall we say, then again, I don't have a problem, because basically they know all about this stuff already, and the language is not really the issue. So the problem comes when I talk to the general public, whether directly giving talks or whether I'm talking through the media. There, I have to, be, on the one hand, very aggressive in saying, look, we need to take this problem seriously, but also I need to be very aggressive in diverting the audience or the interviewer or whatever from any kind of distortion in terms of, immortality or whatever, so that people can see that this is serious science, serious pioneering technology, and not just science fiction. And one thing that I've been emphasizing for a long time, and I think it's really, starting to happen, is that there's only so much that I as one individual can do. I mean, obviously I do have this kind of, spiritual leader role in this field, but at the same time, I have a particular way of saying things, a particular style of discourse and communication, which doesn't resonate with everybody. Nobody can reach everybody. So we absolutely require in this field to have an increasing diversity of advocates out there, people who are willing to get up on stage and on camera and say these things in their own way, and communicate better than I can with certain audiences. I believe that that is happening increasingly now. Of course, you yourself have done a fair amount of that, and you're up by. So that's really excellent, but it's not a moment too soon. We really, really need more of that.
Absolutely. Well, okay. for my benefit and for other people who are doing like podcasts or interviews and maybe doing some documentaries, what would you say would be the some good key messages to sort of focus on, and what kind of dialogue do you think would produce the best sort of mileage, in your opinion, or what would you personally like to see?
So I think really I want to divide my answer to that question into two parts. First of all, messages with regard to the feasibility of all of this, and then messages with regard to the desirability and indeed the importance of all of this. So on the feasibility side, I think what we need to emphasize is, first of all, the progress that is being made, both by aging-specific organizations like SENS Research Foundation and by mainstream researchers in mainstream universities around the world in actually putting together this damage repair panel of interventions that we need. And secondly, the general acceptance of and embracing of that whole paradigm for defeating aging by the I talk a great deal these days about this famous paper that came out in 2013 called The Hallmarks of Aging, which was published by 5 very senior and respected biologists from Europe. I think it's correct to say that that paper is the single most highly cited paper in the biology of aging of this decade. And that's extremely important because essentially it's just a complete reinvention of what I published 11 years previously, the first paper on SENS, which was cited about twice by anyone other than me. So this is extremely good news. Of course, it's a bit of a shame that I didn't get more of the credit, but at the same time, the fact that this is out now, being so heavily referenced and is such a touchstone to define the legitimacy of this kind of approach, that's extremely good news. So I think all of that needs to be said. Well, this is not just some crazy harebrained idea being spouted by one isolated guy with a beard and a strange accent. But then on the desirability side, there's so many arguments that people put forward for why this might or might not be a good thing, or in particular why it might be a bad thing, why we might create problems as a result of solving the problem we have today, or why the problem we have today isn't really a problem. And I've been challenging those concerns for a very long time now. It's not easy to get the message across that we need to take this seriously. And I keep getting better at this. I keep kind of coming up with new ways to knock down these arguments. But everyone needs their own ways. You need to figure out the best way to actually do this. And some arguments are just very ineffective. One of my unfavorite arguments is quite a lot of transhumanists, when they're confronted with the concern that if we didn't have aging, we would have overpopulation on the Earth, they'll say, oh, don't worry, we'll emigrate into space. Now, first of all, that's an extremely unlikely solution to the problem, but also, even if it were a likely solution to the problem, it's definitely not a persuasive one, because the kind of people who are raising this concern in the first place are not the kind of people who want to go to space. So, we should be careful and think a little bit about the psychology of the people that we're talking to. And I've certainly found that over the years, the most effective arguments are ones that are much more general, essentially focusing on the fact that this is all about health, and that nobody wants to get Alzheimer's, nobody wants anybody else to get Alzheimer's, and this is all about simply stopping people from getting Alzheimer's, or indeed any of the other things that old people get, and that the longevity effect is purely a side effect. And then I also talk a lot about a sense of proportion, about the possibility that we might create other problems has to be evaluated by actually asking the question, would these problems genuinely be more serious than the problem we have today? These are the kinds of things that I think one needs to get across in conversations about this.
Absolutely. So, it's great to talk about the long-term impacts and, expanding throughout the cosmos and having lots of lives existing on different planets and sort of going substrate independent, but that's not something that the general public, need to be persuaded about at this stage. If we ever were to get to that stage in the future, maybe then we can sort of have a big public discussion about these.
It's much worse than that. It's not that the general public doesn't need to be persuaded of this for a long time to come. What it is that what one does by talking in those kinds of ways is one actively alienates the public. The public decides that the person they're talking to is a lunatic, and they are dissuaded from listening to anything else that the person might have to say. So you've got to create a foundation of credibility in your conversation before you try to persuade anyone of anything.
Oh, right, yes. But I do get the sense that people, futurists like myself even attempted into the idea that trying to predict or become this sort of mad visionary is somewhat a virtue. And talking about these wild possible futures, not only is it good clickbait, but it's if you're right, hey, you hit the jackpot, and everybody will say, wow, this guy has got a crystal ball.
Yeah, that in the long term maybe. In the shorter term matters as well, though. This is the problem.
Yeah, that's true. So how are we going at achieving robust mouse rejuvenation? Is that going to happen within the next 10 years? Do you think it's a good chance, subject to continued funding like you've seen over the last few months?
I certainly do. I think that the time frame of about 10 years, which I started putting forward about 13 years ago, has come down to probably about 6 years. It hasn't come down as fast as I would like, obviously, but that's absolutely because the funding has been inadequate. I think we could be talking in the region of 5 or 6 years now. And that's because all of the components that we need to put together are now moving forward quite nicely. In particular, I think that we have really made the decisive breakthroughs in what arguably are the two single most difficult components of SENS, namely mitochondrial mutations and extracellular cross-linking. In both of those cases, the approaches that we have felt were necessary were generally agreed, the way to go, but no progress had been made by anybody for at least 15 years. And in both cases, the work that we've funded, in the case of mitochondrial mutations, the work that we've been doing in our own lab, in the case of cross-linking, the work that we funded at Yale University in Connecticut, in both cases, we've really unlocked it, and things are moving forward quite nicely now. So I believe that there's a very good chance that all of these things will be in place within the next 5 years or so. Of course, we have to do more than that. We have to actually combine these things as well as just developing them individually. And there's certainly plenty to do there. So one thing that we are already looking at is beginning the process of combining things that already somewhat work, just in order to unearth any unforeseen interactions that might exist sooner rather than later. So yeah, there's certainly a long way to go, but if funding continues to be adequate, and I wouldn't say it's adequate even now, but if funding continues to increase, then I think we've got a good chance.
Okay, just so viewers know what the goal of robust mouse rejuvenation is and what it might represent to the scientific community, do you want to just give us a quick rundown about the implications of achieving such a thing?
Yeah, sure. So I defined robust mouse rejuvenation way back about 14 years ago as the point where we can take a bunch of normal mice that are of a long-lived strain, so that we haven't got any concerns about their being inherently sick. So typically live about 3 years on average. And we do nothing whatsoever to them until they are 2 years old, so until they're in middle age. And then we throw the kitchen sink at them. We do a whole bunch of different interventions at that point. And the result is they live an average of 5 years total, rather than only 3 years. So in other words, we basically treble their remaining lifespan from 1 year out to 3. Now, I chose those numbers quite conservatively because my goal was, and is, to produce a result in the laboratory with mice that is sufficiently dramatic in terms of rejuvenation that the mainstream gerontology community will be willing to do what I do, to actually go out on stage and on camera and say, yes, it is only a matter of time before we get this rejuvenation thing working for humans, and longevity, escape velocity is a foregone conclusion after that. Now, That's going to take a really impressive result simply because the mainstream gerontology community have a lot of vested interests. You know, they have their next grant application to get funded, and they have to worry about peer review and, you know, getting promoted and tenure and all that kind of stuff. And, you know, that has definitely caused the gerontology community to be extremely conservative. But the reason I consider their input to be so essential is because at the end of the day, they are the people who hold the keys of general public trust and expectation in what's going to happen. If most of the gerontology community are going out that I say, then everyone's going to believe it. You know, Oprah Winfrey's going to say, let's have a war on aging. And, you know, there's going to be a war on aging, like at once. It's going to be impossible to get elected unless you have a manifesto commitment to do that. So that's why I've always focused on mice to a greater extent, really, than the actual scientific argument might suggest, because, of course, mice and humans are somewhat different. And these days, with the way that things have gone, especially with the way that things have gone in terms of the expert opinion in this area, I think that we might actually get to that level of public position of the mainstream community with a rather less impressive result than the one I just described. You know, if we only got one extra year out of these mice rather than two, I think that would probably be enough. And so it's these kinds of reasons, together, of course, with the fact that progress is being made in developing the components, it's these kinds of reasons that lead me to the feeling that in 5 or 6 years, we've got a pretty damn good chance of getting there.
Wow, that's impressive. I mean, considering it's 2018, before mid-decade 2020s, like 2023, 2024, 2025, this could be a real thing. But yeah, the emphasis is the research still needs to continue. In order for that to happen, you still need donations. So yeah, that's darn impressive. Yeah, I'm looking forward to listening to the dialogue in the media and on the street about this sort of thing when such a thing occurs. So yeah, to hear that from you is very very impressive, and yeah. So okay, so I've got a couple of questions here in the chat room. One of them is about an Alzheimer's drug called aducanumab, aducanumab. I don't know how to pronounce that. What's your take?
Okay, so it's one of quite a number of antibodies that have been developed over the past several years that are targeted against amyloid beta, which is, of course, one of the major proteins that accumulate in clumps in the brain in Alzheimer's disease. And really, I regard that whole area as pretty much a solved problem now. The removal of amyloid by the immune system was first reported in mice by a group in the private sector called Elan Pharmaceuticals back in 1999. And actually, that was one of the papers that led me, you know, that I put together into the grand scheme of SENS in 2000 in the first place. So the idea's been around a long time. Clinical trials in this area were initiated really rather quickly, not with this particular antibody, but with an earlier one, by a number of different companies. And after a bit of messing about, they figured out how to do it. So now it's pretty clear that if you do it right, you can really decisively get rid of amyloid in the brain in Alzheimer's patients. Now, the bad news is that only very modest, if any, cognitive benefits have been seen in these trials, in the clinical trials. Now, that to me is not a problem. It's not a surprise either, simply because Alzheimer's is a multifactorial disease. Apart from anything else, not only do we have this amyloid accumulating, we also have another type of aggregate called tangles, which are made of a different protein called tau. And those accumulate inside cells, so it's harder to get to them with antibodies. And we're actually pursuing an alternative approach to try to get rid of tangles. But yeah, I mean, I believe that it's no surprise that if you only get rid of one component of a multi-component problem, then you don't see very much in terms of postponement of pathology, in just the same way that I wouldn't expect that we would have much increase in overall healthy longevity if we fix 5 of the 7 strands of SENS. We really got to fix them all reasonably well. So yeah, I'm very happy about this, but I regard it as a drug, as an approach that we kind of have in our back pocket ready to be combined with other things in the future. It's not so much that it has particular benefits right now.
Mm-hmm. Another question is, people want to generally know what your views are on cancer at the moment, with subject to current research progress. Is SENS making much progress? I mean, cancer is a big field. I mean, it's not just one thing, but yeah, have you got any views on where we're at with cancer?
So first of all, let's deal with the question of whether cancer is one thing or many things. So of course, it depends how you look at it. You can argue for either of those two positions. Certainly my approach since the beginning has been to try to find ways to attack cancer as one thing. In other words, to find commonalities between all cancers. And of course, the one that SENS has focused on is telomeres. The idea that if we were to prevent cancers from extending their telomeres, then we'd be done, because all cancers have to do that. Most of them do it with the well-known enzyme telomerase, and then about 15% of them do it with a completely different system that is still poorly understood. Now, actually, I have to confess that the work that we've done in this area is one of our few non-successes. We worked for several years on this non-telomerase version, this telomerase-independent approach to telomere elongation, in the hope that we might be able to get somewhere with it. But very much like everybody else who's worked in this area, our progress was very, very slow. And essentially, we have mothballed that project right now. We have decided that we just can't prioritize it because we don't have enough of a clear idea about how to make the next step with the kind of money that we have. However, another part of the reason why I'm not too worried about the fact that we've mothballed it is that an alternative approach to combating cancer, which has always been in the back of my mind and has always been featured at the SENS conferences and so on, is making good progress now. And that, of course, is cancer immunotherapy. So cancer immunotherapy is a concept that's been around for decades, and it made very, very, very little progress for a long, long time. But then maybe 5 or 8 years ago, people started to find things out that have changed all that. There are 2 major approaches to attacking cancer with the immune system, or I should say more accurately, to stimulating the body's natural ability to attack cancer with the immune system. One of them is very personalized. It's called CAR-T, chimeric antigen receptors, which is an engineering of T cells. And the other one involves drugs that inhibit something called checkpoints, which are things that the cancer cell manipulates in order to grow. Both of these approaches, and indeed the combination of those 2 approaches, have seen very considerable results, and of course the creation of quite big companies now, such as Kite and Juno, and you know, it's really got a lot of momentum. I believe actually that the best is yet to come in this area. Some of the most exciting work that I know of is focused on essentially doing something even more personalized and even more aggressive than the things I just mentioned, by identifying what are called neoantigens in cancers. A neoantigen is a peptide that is not normally synthesized by the cell, and is only synthesized by the cancer because of changes to the DNA sequence, because of the mutations that the cancer has accumulated. These neoantigens may not have anything to do with why the cancer is a cancer, but nevertheless, all the cancer cells make them. So if the immune system can be trained to identify them, then you've got a very good therapy. And work that has been done over the past couple of years in Harvard has identified that if you find a lot of these neoantigens, like 20, in a single patient, and you basically vaccinate against all of them, then you really, really wind up the immune system, and the results are extremely impressive. So far as I'm aware, the only results that have been reported are a very small phase 1 clinical trial with just half a dozen patients, but the success was just out of this world. Like every single one of these patients with late-stage melanoma had complete remission. So, you know, this is better than you ever see in any and I'm extremely excited by it, and I'm following it very closely. So it's just possible, that within the next couple of years, we will be in a situation where the whole anti-telomerase approach to attacking cancer can be sidelined. We've always known that it's a very ambitious approach, the anti-telomere approach, because it has big side effects in a number of other tissues, which would have to be compensated by stem cell therapy. And a number of people who are generally on board with the rest of SENS think that approach to combating cancer is basically a non-starter. I think that's too strong, but still, it's definitely very hard. So if we can really get cancer immunotherapy to work, nobody will be happier than me.
Fantastic. Now, George Church has been working on aging as well. Apparently, David Ellison has said that he's claimed to fix aging within 6 years through epigenetics, with a view having it ready as a medicine within 10 years. I haven't heard him say that, but that's one of the questions in the chat room, or one of the discussion topics. Would you like to address that?
Yeah, I don't really know quite what George was referring to there. That quote of his has certainly been very widely distributed, but we all get slightly misquoted in the media all the time. So I wouldn't put too much weight on it, to be honest. I think he's obviously an extremely smart and extremely knowledgeable guy, and he's doing a wide range of extremely exciting stuff in his lab. But we all know how difficult this is. So let's hope for the best.
Another concern is that people is for autoimmune diseases that, according to some people, seem incurable at the moment. What are your views on dealing with this issue with autoimmune diseases? Yeah,
for sure, autoimmune problems are a big deal in medicine, and they do get worse with aging. Now, the interesting thing is that the reason they get worse with aging is basically the same reason why we also lose general terms of the ability to fight off infections with aging, and indeed to attack cancer for that matter, coming back to the previous topic. The reason is, essentially, the immune system loses precision. The immune system has these two arms, as most of you probably know, the innate system and the adaptive side of the immune system. And the adaptive side works by having a vast variety of different cells with different rearrangements of particular parts of the genome that confer specificity of the immune cell to a particular target that it may or may not encounter at some time in the future. Now that what's called polyclonality, that very, very wide diversity diminishes over life. And because it diminishes, that means that the cells which are targeted towards a given problem for the immune system tend to be less precisely adapted to it, less optimized for it, and on average. And therefore, it takes longer for those cells to do their job, or they don't do it so well, and so on. In the case of autoimmunity, you've kind of got the same thing, that the immune system always has to be very faithful in distinguishing between things that are foreign and need to be got rid of versus things that are not foreign and are actually part of the body. And that ability also, that discrimination ability also diminishes for the same reason. So I think basically that the autoimmune problems with aging have a good chance of being quite powerfully addressed by the same measures that we are already developing to rejuvenate the immune system generally, by, for example, regenerating the thymus and by eliminating basically senescent immune cells that are accumulating in the bloodstream and elsewhere.
Okay. Another question is, which bottleneck do you believe needs the most attention on behalf of the community that's already convinced aging reversal technologies is an important problem to solve?
I'm sorry, could you repeat that question? I only got half of it.
Oh, okay, yes. So what bottlenecks, I think, do you think needs the most attention on behalf of the community who already are convinced that regenerative medicine and anti-aging medicines are a good thing?
Well, I certainly Makes sense. I would certainly say that even though SENS Research Foundation and other organizations have been quite fortunate over the past few months in terms of obtaining new funding, nevertheless, the funding is still by far not adequate, and that the shortage of funding, the shortfall from what we really need, is still by far the major problem. We know how to spend money. We know what kind of projects need to be done. We also have the people, the world-leading scientists who are in the best position to actually perform this work if we could pay them to do it. You know, these are people who have been in dialogue with us and with the community for a long time, that the work that we want them to do is interesting and it's, you know, valuable and so on. So it's just a matter of providing them with the resources. And as such, I think that the priority of the whole community still needs to be to continue the process of persuading people, whether wealthy people or less wealthy, it doesn't matter, to get on board with this and to actually supply financial support to all of this. The second thing I would say is that as we become closer and closer to the point of robust mass rejuvenation, we need to do more and more to get decision makers, especially policy makers, to understand and anticipate what's coming. I believe that the ultimate goal of saving as many lives as possible comes down not only to developing these therapies as quickly as possible, but also to ensuring that once they are developed, they get disseminated as quickly as possible to as many people, to everyone who's old enough to need them.
Fantastic.
And that requires forward planning, a lot of forward planning. What we absolutely do not need is a situation in which these therapies arrive, or indeed these therapies become widely anticipated by the public when policymakers and decision makers and businesses are simply haven't thought about it. They're simply taken by surprise. There will be complete fucking chaos if that happens, and you know, a lot of delay will result from it, I believe. So I think when I talk to anyone who is interested in the longer term, you know, of humanity, in particular in policy making, whether at the government level or in the private sector, and insurance companies, for example, pension funds, those people, you know, whenever I talk to them, I always emphasize how absolutely urgent it is to have proper discussions about this. I talk about anticipating the anticipation, by which I mean, of course, getting ready for the public to be anticipating all of this, as opposed to the current situation where the public is still desperately trying to carry on thinking that the whole thing is science fiction. It's never going to happen.
You mentioned like there's a few incentives there. There's a philanthropic incentive, and there's the incentive of personal, I guess, health, like the personal motive of making it to a longer term future, and also there's the economic incentive. Yeah, I guess people want to know what the best arguments you've seen so far, the clearest arguments you've seen so far in these areas, if you can point people to them, or, you know, briefly describe what you think.
Sure. Well, I guess, you know, the main thing that one has to do in order to be effective as an advocate in this area is not necessarily to take people who are just opposed to it and get them to be in favor of it. That's a big ask. You know, even if one can make an incremental difference, you know, getting people who are undecided to be in favor of it, or getting people who are opposed to it to at least be more reticent in their opposition and not try and persuade other people to be opposed. You know, this is still quite big. I mean, just to illustrate, you know, I point to at least a couple of very wealthy supporters of SENS whom I know personally, and who have never given us any money, or who gave us money in the past but then stopped, and where I know for a fact that the reason why they don't give us money is because their wives are opposed to it, right? So, you know, this is not what we want, and as such, you know, it doesn't really matter who you're talking to. If you can get them just one notch up the scale from opposition to support, that's still valuable. That's really important to understand.
Mm-hmm. I like what you said about not necessarily trying to attack or oppose opposition, but just coax them into becoming more reticent, in a sense. At the
end of the day, if someone is opposed to something, then they'll give reasons, but it doesn't matter how many times you knock down their reasons; they always come up with another reason. Yeah, you just want to make them feel a little bit more embarrassed about being opposed.
Fair enough. All right. Well, that's been fantastic so far, and I really appreciate your time to do another interview with me, Aubrey. It's always a great pleasure, and it's an honor. And you're doing such great work, and I can't emphasize that enough. Really, I mean, I've been watching you from for quite some time now, and it's been really amazing. And I'm so happy that there's been solid progress. So that's amazing. Yeah. So cheers. Thank you very much for engaging me, and also a lot of everybody else with the community. You've had so much energy to do all this, and I don't know where you get it from, but I hope to get some too at some stage.
Well, thank you, Adam. I mean, as we all know, you too have been doing a great deal in terms of energy, especially in the Southern Hemisphere. You know, we need more people like you all around the world. So I want to express my gratitude to you for interviewing me periodically, but also for everything else that you do.
Yeah, thank you very much. And look, I'll be watching with great enthusiasm over the next year to see how things go. And I hope you get more donations from all sorts of spaces, crypto including. I was quite surprised, actually, when that happened. And yeah, it's a great windfall in all of our favour. So, yeah.
Well, thank you. Thank you.
Cheers. Speak soon. Bye.